Hi guys, we are coming almost to the last model of psychopathology. Yes, we call this the biopsychosocial model, Engel 1977, or we call it the thesis stress model, or the illness dash or hyphen vulnerability model. Yeah, so the diathesis stress model, diathesis, Diathesis. So thesis, there is a synthesis, there is a cooking, a blending. There should be something to there. Then stress, there is a stress, a trigger, a stressor, a situation, an event, right? So I'm trying to look at it that way. Then the biopsychosocial, there is a biological factor, there is a psychological factor, there is sociological factor. That is this theory. So you understand that if you look at other theories we have looked at, they are looking at them individually and very specifically looking at their positions. But this theory is telling you that if you want to have a good understanding of psychopathology, it should not be something that have a single explanation to its etiology. A comprehensive understanding, or am I saying the right thing? What I'm trying to say is that they believe that psychopathology is not caused by a single factor, but the multifactorials. It is caused by several factors. According to this theory, individuals are, however, oftentimes predisposed to several, genetically or inherently or innately predisposed to these disorders, which, please carefully listen, which when triggered by stressors result to psychopathology. What are they trying to say? They are trying to tell you that individuals perhaps may, even though they are having this inherent in them, these psychological disorders, predispositions in them, if they are having it, they perhaps may not go through these mental disorders or having any mental disorder in all their life, unless triggered by any stressful event or situation called stressor. Very important. What are we saying? As much as we know that schizophrenia, depression, they have these genetic factors, they are what's the word again, transmittable, right? You can inherit them. But we are trying to say this theory that individuals with this could go through life without for once suffering these disorders, unless there are situations, there are events that lead to it. Just like the biological aspects, like illness, like diabetes. Individuals born in families that have diabetes mellitus in their bloodline could go through life, some or all could go through life without having diabetes, unless that gene is triggered by a situation that will precipitate diabetes, unless the child of those diabetic parents engages in careless use of carbohydrates, sugary things. These are serving as triggers. Individuals with inherent biologically predisposed to depression may and can go through life without being depressed, unless an event like failure in school, like academic or occupational problem or failures, like relationship problems, triggers it. This can serve as stressors. Individuals with schizophrenia in their bloodline. Okay, I have a friend that at some point, although schizophrenia was in the bloodline, but the whole situation got triggered when the child got curious about some particles of Indian hemp kept by the elder brothers, and she was like, okay, how does this? And she puts it in the water and she drinks it, and everybody was like, okay, please help her, come on. And she started shouting. Everything happened that day, nothing happened, but later the awakened gene started. I think this is very explanatory. So predispositions is one, then psychological or sociological or environmental triggers, stressors could lead to psychopathology. So the biopsychosocial model of psychopathology, and this is the last theory. We have looked at all of them and we have seen their explanation to psychopathology, and as we discussed at the end, we remember that we said demonological said what? We should remember again that the biopsychosocial, in their treatment, we consider both biological and psychological treatments, even sociological treatment. You must incorporate the whole of them. In fact, you may have to bring psychotic drugs or psychotropic drugs to help the symptoms, then engage in psychotherapies depending on your orientation, and can also encourage environmental modifications if it's peer groups that are also labeling him or looking at him or even helping him to continue that negative behavior like smoking or anything. Change the environment. You see the approach this model takes. So in conclusion, we remember we have discussed that the demonological theory said that psychopathology is as a reason of what? Possession by spirits, while the biological model says psychopathology comes from genetic factors, chemical imbalances, brain abnormalities, neuroplasticity, and hormonal imbalances, while the psychodynamics say that psychopathology or abnormal behavior can be seen through some negative experiences, earlier childhood experiences, and inability of the ego to resolve the conflict between the id and the superego, and other problem in childhood development, right? Negative or fixations, as in psychosocial theory. Yes, so majorly they are saying psychopathology is as a result of problems in earlier childhood experiences, which are stored and repressed in the subconscious or the unconscious. And the behaviorist perspective say that psychopathology is as a reason of what, or it's caused by what? Negative learning process, that we learned it through paired association, as in classical conditioning, through reinforcement and reward or punishment, that is operant conditioning, and through modeling or observation and imitation, that is social learning. And cognitive behavioral therapy or cognitive theory say that psychopathology is as a reason of what? Irrational thinking pattern and cognitive biases. Yes, and the family system theory states that psychopathology is a problem in the system, in the family practices, problem in the system practices, or whatever you can call it. And then we have the socio-cultural factor that do not see individuals as having any psychological disorder. Some of us say that it's a myth, that psychopathology is just an ordinary problem in the cultural, historic, and institutional system or factors or processes. Yes. So he said that psychopathology is nothing but a problem in everyday living, while Thomas Sheff said that it's as a reason of labeling, and as labeled then they behave. He's stupid then he behaves as stupid, and he continues in that line because this culture sees him as same as that. They called him that, and he fulfills that labeling. They saw him as a thief because he stole bread out of hunger, right? And they now tag him and label him thief. He becomes thief. And David Ronald Lane said that psychopathology is problem in everyday. Okay, that psychopathology is not inherent in the persons or individuals, but in the environment. That individuals, that what we refer to as psychopathology is individuals' response to the abnormal environment. That the environment is the one that is abnormal and not the individuals. Then we looked at the social conceptual model that says that individuals that poor lifestyle or low social class precipitate mental disorder, while the drift hypothesis says that mental disorder precipitate low economic class. Then lastly, we also looked today at the biopsychosocial model of psychological disorder, which considers not either of the factors, but generally the factors, the whole the biological factor, and then the psychological or environmental factors that could precipitate or predispose the individual. So there are biological predispositions, and there are psychological and sociological precipitators and perpetuators. That is biopsychosocial model. Biological predisposition and psychological and sociological precipitations and perpetuators. Okay, that is it, and thank you guys. See you guys as we take on the several psychological disorders, and please remember to like, share, and subscribe if you have not. God bless you.